touched a lot already, right? But let me ask you this question. That is, now imagine yourself, let's say you are someone who is a melanoma just diagnosed, and you want to find the best dermatologic surgeon or just general surgeon, plastic surgeon, anyone that will remove this. How do you do the research? How do you sort of qualify someone? How do you, when you go in, what aspect, characteristic of that surgeon you should be looking for?
Well, I do think the first thing is truth in advertising, and we want a board certified physician, and we want a board certified physician in what are the legitimate boards. And so, in answer to your question, first of all, you can find out who's passed their boards in dermatology. And I think dermatologists, we are experts in the skin, hair, and nails. And if it's a relatively early melanoma that does not require lymph node removal, that would be a terrific choice. There's board certification. You don't want to just see the words board certified because you don't know in what. So you want specifically either that, perhaps in plastic surgery, but even there, I think you want somebody that has a track record in dealing with melanoma and reconstruction. You don't necessarily want the person that does, breast implants all day long.
Yeah.
Be the right choice.
Yeah.
If you do need the lymph nodes out, then we're looking more maybe at what we call head and neck or general surgeon. But I think that you could start with your primary care doctor and get some names. You could start with, an internet search. And one thing that I think is also very good is the Skin Cancer Foundation, which I happen to be president of. We have a website, skincancer.org. And on that site, you will find out a host of information about melanoma and about cutting edge treatments of melanoma. But there's also a guide there to find a doctor. And these are people that are already vetted, that have passed their boards, they're dermatologists, and they have an interest in treating skin cancer. Also, the American Academy of Dermatology and the ASDS, which stands for the American Society of Dermatologic Surgery, they have websites that would have doctors that you can't be in these societies unless you are vetted. And once again, this is your area of expertise. So I think that there are ways. I would not necessarily trust some of the online reviews because I don't think that some of them are paid for, and some of them may just be people that have an axe to grind that maybe had a long wait in the waiting room or something that wouldn't be relevant to the expertise and the abilities of the doctor. And you might ask around also for if you have family or friends that have had melanoma with a positive experience from the whole thing. That would be another way to go as well, to find, I think, a doctor that is well suited to take care of you. And you can interview more than one, because as much as we want to excise clear margins around a melanoma, when you find out you have a melanoma, I don't think it has to be done the next day. I think if you want to do your due diligence and take a couple weeks to go and find the person you feel the most comfortable with, that's okay too.
Yeah, it makes a huge difference. And not only the physician, but the staff and the whole office, everything makes a huge difference. I think